you feel like you have to perform when you get to therapy, that maybe you want your therapist to think that you're funny or interesting, or you don't want to be too much for your therapist. Hopefully, this video will help you to come to terms with that and to understand and accept why that's happening. My name's Laura. I'm a therapist here in the UK. I'm making videos on YouTube to help people to use therapy well and to know how to access it and get the most out of it. So, if you've started therapy and you feel the pull to make sure that you're looking after your therapist, so you're asking them how they are and you're checking in, is this too much? That's really nice. It's so sweet when I have a client that does that, but I don't need it. I wouldn't do this job if that was needed and necessary. So as much as it's something that I like, you aren't there to do things that I like. You're here so that you can grow, so you can learn, so you can explore about yourself and trying to make sure that I'm okay. Maybe that will make it a safer place for you. And if that is the case, then we can talk about that. Why is it that you need to know this? Do you trust me enough to be able to turn up to do my job and be settled emotionally enough to do it? Or is it something that I need to reassure you? Because if you need that reassurance, I will give it to you. But let's talk about why you need that reassurance. So we don't need to be polite to our therapist. There's so many people who will swear and then apologize, and I don't care if you swear. I think that a lot of the time it's very, very valid to swear about some of these situations that people are talking about in therapy. And I don't want anyone to feel guilty like they're going to offend me because they're not going to offend me. And even if it was something that was, quite rude or mean that they say in session, I'm separate from that and that I can hold on to the frustration, the anger without it offending me. I'm able to kind of go, right, that is something that they needed to express to me, but I'm here, consistent. I know who I am. I'm not swayed by the way that I'm spoken to. I've never actually had a client do that, but if you were to swear in session about the situation, obviously that's really valid. If you were to swear at me, that's fine too. Because I want people to feel like they can be honest with me. I want them to stay when they feel uncomfortable. I want them to say when you didn't quite get it or it wasn't quite right. Because it's only when we can communicate those things that we can deepen the relationship. And having a relationship where you feel like you can be heard, you can be seen, you can say things that it's not very common in our day-to-day society, friendships and social interactions, that we are that honest with people and we let them know how they are being observed and how we are experiencing them. But in therapy, we do that. And it's great practice for us to be able to observe, hang on, that didn't sit right with me. In the moment, I'm going to say it. I'm going to say that this wasn't quite right, or that I don't think you quite understood. And when that happens in therapy, I'm so happy. I'm like, please tell me more. Let me understand. Explain it to me in another way. If you need to tell me however you can, and I'll keep trying to understand because it's really important that I understand what you are trying to explain to me. And it can be a little bit frustrating. And sometimes, very occasionally, there's like a mental block on my side. And that's where something that I would need to take to my own supervision and say, look, I had a mental block about this area. But usually all it is that it's something that I'm unable to understand until you explain it to me a little bit more. So please feel free to talk honestly to your therapist and say, I don't think you get this and tell them why. When you said this, it showed that you weren't quite there for me. A lot of my clients like to make me laugh. And to be honest, I like to make them laugh. I feel like there's so much healing in laughter. And I really enjoy people's company, but we're not here to entertain one another. We're here because you need that safety in relationship to explore, to get to understand yourself. And sometimes humor can be grounding. So when we notice sometimes that we laugh when we're nervous, it feels inappropriate sometimes. However, all that is your body going, I'm feeling unsafe. I'm going to do something to bring myself back into my physical space. I'm going to make myself more aware of my body and where I am in time and space. And so we do a little laugh. And it's really awkward because it might not be appropriate. And then someone might say, oh, sorry, I laugh when I'm nervous. And that's why they laugh when they're nervous. So the other thing that we need to talk about is the therapist's ego. You don't need to progress so that I feel like I'm doing a good job because I do the same job with someone who is making great progress and reaching the goals as to why they came to therapy, getting relief from unpleasant experiences, unpleasant emotions, being able to manage and understand themselves better. I'm using the same clinical skills with that person as someone who might have talked about the same topic for 12 months. And that's okay because maybe what's going on for the person who's brought the same topic for 12 months is so much more entrenched and they're not able to move forward until we hit something that hasn't been untangled or they're going around and around because they're unsure that they can look any deeper and they're trying to navigate how they can do that in the sessions. And it's nothing to do with me. I'm providing the same conditions. What it has to do with is where the client is at. So if you're having great progress in therapy, brilliant. I'm super happy for you. And if you feel like you're needing some support and it's taking a long time and it's a bit of a struggle, that's fine too. And we can talk about that and let your therapist know, I'm not sure if this is working for me if you're at that point, or if you're just at, I don't think I've gotten to where I want to go, but I know that I'm on the right path. That's fine. Therapists don't do their job because we get great reviews. It's so lovely when we get some feedback, but I never ask for feedback. It's not part of the role. And I want people to feel like if they say something, they're saying it because they want to, not because it's going to help my business or anything like that. So, thinking about the ego of the therapist, make sure that you're not performing for your therapist. You're not doing this just because it'll make them proud. Because actually, what we've done there is we've added another condition of worth. I'm only worthy to my therapist if I implement the support and I start to reflect in a different way and I move forward and I don't deal with the same problems and I'm on a time scale. Therapist isn't going to feel better or worse about themselves because that's happening for you. They'll be happy for you, but it doesn't mean that their next client is going to be any better off or worse off. And you might be 1 out of 5 people that therapist sees that day. And so having that person who's doing really well, it might feel nice for them, but it's not going to give them an overall view of how they're going as a therapist. And actually, for me, when I have someone who constantly tells me, this is really useful and I'm getting so much out of it, and this is all of the things that I've done, it's like a little flag to me of, hang on, there's some conditions of worth here that they want to be valued on the basis of their progress rather than just being valued because they're human. And there's no way to get any extra value to you as a human. You can't build that. You just have it. So before I finish, just want to remind you that being in therapy is because you need it. You're not there for the therapist. You're there because it's something that's important for you. So if you can take some time to just pause, and then you're not going to be reflecting on how to make the therapist feel good. You're reflecting on this is my time. How can I use it the best I can? Thank you for your time. Take care.